listen, we got some news for you. You know, so far, the Affordable Care Act, the rollout of Obamacare has been absolutely flawless, right? I'm being funny. Now there's another debacle. Last night, Verizon, which apparently runs part of the data hub. Can you hear me? Can you hear me now? No, nobody could hear anybody in 50 states, all 50 states. Verizon said it was because of, quote, failure in the networking component that brought down network connectivity to the site. Anyway, it didn't work.
No, it didn't. So that actually, the connectivity issue is a problem. And actually, on Saturday, Kathleen Sebelius was bragging about how well the program was running and how it could perform like quick calculations. Well, none of those calculations were happening yesterday during this shutdown. And there were actually they were blaming parties going on because they're blaming the contractor, Terramark, I believe, who's a part of Verizon for this issue. But all of the information hub. All right, so that hub holds like your social, nothing important, your financial information. That is now being looked at as being exposed potentially.
Exactly.
To security threats.
Yeah, that is, you're talking about exposure. So the big question is, Kathleen Sebelius is going to have to answer, she thought a set of questions. Now she has to answer hub questions. Yeah. And then she's going to have to answer security questions when she testifies this week. Because somebody that knows used to be a high-ranking guy with the FBI, Representative Mike Rogers, now in charge of Homeland Security in the House, says, I got a problem with the security on healthcare.gov.
It was very clear to me in the hearing that they do not have an overarching, solid cybersecurity plan to prevent the loss of private information. I'm even more concerned today than I was even last week. I know that they've called in another private entity to try to help with the security of it. The problem is they may have to redesign the entire system. The way the system is designed, it is not secure.
Yeah, well, you got the gist of what he was saying.
Sure, it's
essentially, when you hit in all your personal information and then find out how much you're going to be paying your plan, now you got to be hesitant when you do, in fact, log on, that all this information is not going to be going public, and you got to get an apology email down the line.
Well, or even worse, if it's not secure, just imagine if every person who applied could potentially be the victim of identity theft. I think that's a new wrinkle in what has been a debacle. It's been so bad. The geniuses across the street at Saturday Night Live saluted Kathleen Sebelius this past Saturday night. Did you miss it? Here's 26 seconds.
If our website still isn't loading properly, we're probably just overloaded with traffic. Millions of Americans are visiting healthcare.gov, which is great news. Unfortunately, the site was only designed to handle 6 users at a time. So if you're in a rush, consider using our low-res website with simpler fonts and graphics.
That's funny.
I mean, funny but scary, because the truth is that this is a huge problem right now. And Senator John Barrasso, did you see him, the Republican? He actually said that Sebelius is a complete laughingstock, and I think he means it in a serious way.
And you talk about Secretary Sebelius and her comments. She's already, as of Saturday Night Live last night, the laughingstock of America. So she's lost considerable credibility.
Yeah.
No smiles
Do you
there.
think?
And he, by the way, is a doctor. So he was valuable insight there. And Senator Barrasso has been out and about this. Now, the big question is this not working because certain states have decided not to set up their own exchanges? Or is this not working just because they haven't planned it well, haven't gotten the right technology straight, and the website's just bad? That question is a perfect question, Steve, to put to the Kentucky governor, who happens to be a Democrat.
He is. And so he was on with Meet the Press yesterday, and it was revealed that a whole bunch of people in his state are signing up. But they're not signing up for Obamacare. Listen to this.
At 12:01 a.m. on October 1, when our exchange opened up to enrollment, Kentuckians started swarming all over our exchange, all over our toll-free lines, and in about 4 weeks, we've had over 300,000 Kentuckians trying to find out and finding out about affordable health care. We've signed up over 26,000 people so far.
Mostly Medicaid, though. They're mostly getting Medicaid, so it's not the young and healthy people getting the insurance plans that are really necessary to make this system work.
Of the 26,000, 21,000 are in Medicaid, 5,000 are in qualified health plans, but we've got another 10,000 going on to the plans that are in the process of choosing.
By the way, and that was the magic of the follow-up question. So there's only 5,000 people who have signed up for Obamacare out of the 26,000 have signed up in Kentucky, considered one of the few bright spots on the whole case. And bring up this, too. 10 separate Democrats have called for a delay in Obamacare. I think that number's only going to grow if this continues.
10 Democrats that are representing the Americans, but so many more Americans, to your point, would love it to be delayed. They're seeing their doctors pulling out of programs. They're getting letters from their insurance companies. And now here we have this situation where our security information could be anywhere. And then we have a system that's clearly not working. So those 10 Democrats may be representing millions of Americans.
I think the delay gives the president a bailout. You're giving him more time to get it going.
Do you think you should just let it fail?
Let it go, or let it succeed. Let's see how this plays out, because then he avoids another election where the American people should still talk about theory and not implementation.
Interesting.
I just don't know if it's in his DNA to say, you know what, the Republicans were right. You know, they were right all along. You know, remember, that's what the whole government slim down, Senate shutdown was about, was you got to delay, at least delay it. Of course, they wanted to defund it. But what's interesting about what's going on in Kentucky is it looks to some as if Obamacare really is Medicaid. And if you're on Medicaid, you know that oftentimes it is very, very hard to find a doctor. So is that the future? If that's the future, it's not what we were sold.
Steve, by the way, you said that maybe the president's not in his DNA. It might not be in his power. Listen to one Senate Democrat, Joe Manchin, on what bothers him about this program, not the implementation of the website. Listen.
If we have a bipartisan group, which we've had before, when they shut down to get it back open, we had 7 Republicans, 6 Democrats, and an independent. George, nobody should be forced to buy a policy that costs more than what they had and is inferior to what they had.
Oops, that's what a Republican's been saying. And that's what people are finding out right now. That's a Senate Democrat who says, if my constituents are paying more for a policy they don't want, that's not okay.
It's like common sense to me, right?
Right, exactly. But I think the people in the administration have known all along that everybody, aside from the fact that they're the very sick and the very poor, I think they've known that the middle-class health care bill is going to go up. There's an item in the L.A. Times, of all places, yesterday that said that in California, the average middle-class family's health care costs for policy were going to go up 30%. And there's one quotation I saw online that said, you know, I was all for Obamacare until I found out how much it was going to cost me.
Sure. Promise is broken, but we're going to keep our promise and go right to Heather now, right, with some